Hey people. Okay, so I get asked a lot about testing in functional medicine, specifically as it relates to midlife in women, menopause, perimenopause time. Obviously, what comes to mind first and foremost is testing hormones, which of course I do. Dutch testing, saliva testing, sometimes blood testing. And your choice of what type of test to do at that stage in life depends on your symptoms, your age, your risk factors. Things like Dutch testing will help you understand your estrogen metabolism in addition to all kinds of other markers. Saliva testing can be very helpful. Menstrual map testing, which is a urine test if you're still cycling and kind of wondering what's happening in your cycle. In other words, lots of functional medicine options out there for testing that I love. And I want to make sure that you understand that you shouldn't just be testing estrogen and progesterone or testosterone. You need to really test your cortisol. You need to understand your thyroid in depth, TSH, free T3, free T4, thyroid antibodies, DHEA, which is a precursor hormone. In addition, you really need to understand at this time in your life, if you don't have a really solid understanding of where you are from a cardiometabolic standpoint, risk standpoint, meaning the way that your body is managing its lipids and cholesterol, how your body is managing your blood sugar, how your body is managing its inflammation, and all of the contributions of those really common precursors to chronic disease at this stage in life really need to be unpacked and understood. So it's not just the typical cholesterol panel and fasting blood sugar. It needs to be a CRP test. It needs to be an A1C, advanced lipidology, homocysteine levels, all of those kind of things. If you don't know where you are with those parameters, you're missing out on opportunities to address them now at this stage in life before they can become chronic health issues. So instead of just that basic slip that your primary care doctor does where the same tests are done on everyone in your annual health exam, you really need to be looking deeper at your hormones, your stress levels, your thyroid, your nutrient markers, your cardiovascular health from a functional medicine standpoint. So demand it. If you're not a Vytal Health functional medicine patient, come on over and be one, because it's really, really important that you have a really firm knowledge of all of these aspects of your care.